For 11 months, Marcus Vale hadn't made a single sound. Not a word. Not a laugh. Not even a cough. At 38, he ran the most powerful crime family on the East Coast from a stone house in Oyster Bay, Long Island, a man who never had to raise his voice, because one quiet sentence from him used to be enough. Then the sentences stopped. Doctors flew in from Boston, from Zurich, from anywhere his money could reach, and every one of them left saying the same impossible thing. There's nothing wrong with him. 14 nurses came through those iron gates. 14 were sent away. And on a cold Tuesday in March, the 15th pulled up in a rusted Honda with a taped-up side mirror a 27-year-old woman named Sonia Marchetti, buried in debt, quietly frozen out of every major hospital in New York for telling the truth about a doctor who'd been lying, and out of places to go. Nobody in that house expected her to last the week. Nobody expected her to last a day. But Sonia walked into that room and did one small thing that 14 trained professionals hadn't once thought to do, and the most feared man in the state looked up at her like a drowning man seeing a rope. If this story pulls you in, go ahead and hit that like button. Share it with someone who needs to hear it tonight. And subscribe, so you don't miss what comes next. Now let's get back to the story. The iron gate closed behind her with a final, decisive sound, and the man who came out to meet her didn't offer his hand. He only gave his name, Arthur Kessler, then walked ahead of her, slowly, without turning around even once. At 61, he moved like a man who had walked this same path for 30 years and knew exactly how many steps it took. Before pushing open the wooden door at the end of the hallway, he stopped and gave her 3 rules, each one delivered as neatly as an item on an inventory list. First, she wasn't to ask anyone in this house about their work. Second, she wasn't to bring her phone into his room. Third, and this was the only time he placed any real emphasis on his words that entire morning, she was never to touch him unless he gave her permission. Sonia nodded, then asked a question she wouldn't even remember asking until many weeks later. If he doesn't give permission, how am I supposed to know? Arthur looked at her a moment longer than necessary. You'll know, he said. Then he opened the door. The room beyond was a study, its walls paneled in dark wood, its tall windows overlooking the bay, and everything inside it was silent in the peculiar way. Only very expensive rooms ever seemed to be silent. Marcus Vale sat in a leather chair turned 3/4 of the way toward the window. He wasn't reading anything. He wasn't listening to anything. There wasn't even a glass of water beside him. His back was straight, both hands resting neatly on his thighs, his thumbs perfectly still, and he sat there with the posture of a man presiding over a meeting everyone else had abandoned long ago. He didn't turn when the door opened. He merely shifted his eyes, and Sonia understood immediately that this man hadn't lost anything except his voice. The woman standing by the fireplace stepped forward first, and she was the one who spoke. Miss Marchetti, I'm Vivian. I'm his wife. Her voice was warm and clear, her pace just slow enough to sound helpful. She began explaining his routine, his sleeping hours, how he often became tired in the afternoon, which medications needed to be given at exactly the right time. Then she said it. He doesn't understand everything, so don't waste your time. If you need anything, just ask me. She said it while standing exactly 2 steps from her husband, without lowering her voice, without glancing toward him, in precisely the way someone might speak about an expensive piece of furniture waiting to be repaired. And Sonia saw something that perhaps no one else in that room noticed. Or perhaps they had noticed it so many times that they had simply stopped seeing it. Marcus Vale's right hand, resting on his thigh, closed. Only slightly. Just enough for the color across his knuckles to change for half a second before returning to normal. He gave no other reaction. He didn't look at his wife. But that hand had answered for him. Sonia didn't respond to Vivienne. She didn't say yes. She didn't say I understand. She didn't say thank you. She set her bag on the floor, walked around the low table, and stepped directly in front of the man sitting in the chair. Then she did the thing that, throughout the 18 months that followed, she would never be able to explain why she'd done in that very first moment. She lowered herself down. She didn't kneel, only crouched until her eyes were level with his, close enough that she could hear him breathing, and she spoke in an ordinary voice, no louder, no slower, without that particular tone people so often used with the sick and with children. Mr. Vale, I'm Sonia. I'll be the person caring for you. She paused for exactly 1 beat. Is that all right with you? The entire room seemed to stop. Arthur Kessler, standing in the doorway with both hands clasped behind his back, didn't move, but Sonia clearly heard him draw in a breath. Vivienne opened her mouth, then closed it again. Somewhere downstairs, water moved through the pipes, and suddenly the sound seemed unbearably loud. Marcus Vale didn't nod right away. He looked at her. He looked for a long time, long enough that Sonia began to feel numbness spreading through her knees, long enough for her to understand that he wasn't studying her face at all. He was searching for something behind it, something he had searched for many times before and failed to find. And in that silence, something passed across the face of the most powerful man in the state, swift and naked, something a person who was still whole would never have allowed anyone to see. Then he nodded, one single nod, small and decisive. It was the first time in many months that he had chosen, on his own, to answer a stranger. Sonia stood, brushed off her hands, and said, "Thank you, sir," as though they had just completed some perfectly ordinary administrative formality. She turned back to pick up her bag. Vivienne had already recovered her rhythm. In the same warm voice as before, she said it was certainly an interesting approach, that she appreciated Sonia's enthusiasm, that Sonia's room was at the end of the west hallway, and dinner was at 7 o'clock. Sonia replied, "Yes, ma'am," and bent down to zip her bag. At that exact moment, in the mirror hanging between the two windows, she saw Vivienne Vale's face. The woman was smiling, her mouth curved at precisely the right angle, both cheeks lifting evenly, a smile so perfect it could have been photographed. But the upper half of her face was completely still. There wasn't a single crease at the corners of her eyes, not the slightest movement in her eyebrows. The smile ended at her cheekbones and didn't travel even a fraction of an inch farther. Sonia straightened, lifted her bag, and walked out of the study with a question beginning to take shape in her mind, one she wasn't yet willing to name. If this man understood everything, and it was obvious that he did, then why, after all this time, had no one in this house bothered to ask him a single question? At 7 o'clock that evening, the housekeeper brought up the medication tray and set it on the table beside Marcus's chair, then withdrew immediately, as though she had long since grown accustomed to no one saying a word. Sonia didn't give him the medication. She pulled a chair over, sat down across from him, and began doing the thing every nurse was taught in the first year of training, but very few still bothered to do after the third. She picked up the first pill between her fingertips, held it where he could see it, and read aloud. "This is your blood pressure medication. 1 tablet every evening. It may make you dizzy if you stand up too quickly." She placed the pill back down on an empty spot on the tray. She didn't hand it to him. Then she looked at him. Marcus Vale didn't move for about 3 seconds. Then he nodded. Sonia gave him the pill and the glass of water, waited until he had swallowed it, and only then picked up the second tablet. "This is for your stomach. It's supposed to be taken 30 minutes before a meal. You took it 2 hours after dinner, so tonight it's almost useless. But if you want to follow the prescription exactly, I'll still give it to you." He nodded. The third pill was a low-dose sedative. Sonia read the name of the medication, read the dosage, then added the one thing no one in this house had ever told him. "This slows your reflexes, and if you take it every night for months, you'll feel mentally slower than usual during the day. Some people will look at that slowness and assume you're confused." She set the pill down. Marcus Vale stared at it for a long time. Then he shook his head. Sonia took the notebook from the pocket of her uniform, opened it to that day's page, and wrote in neat handwriting, reading aloud as she did. "Patient declined evening sedative dose. Noted at 7:20 p.m. Signed Sonia Marchetti." Then she closed the notebook and said the sentence she would repeat every evening for the next 40 days. "You nod. I give it to you. You shake your head. I document it and notify the doctor. This is your body, not mine, and not anyone else's in this house." Marcus Vale held out his hand. He pointed to the notebook in hers, then to the pen clipped to its cover. Sonia handed him both. He rested the notebook on his thigh and began to write slowly, in the large, square handwriting of a man accustomed to signing documents other people had to read carefully. Then he tore out the page and handed it back to her. "You're the first person in this house who's asked me before doing something to me." Sonia read the note twice. She wanted to say something, and she knew exactly what she wanted to say, but she didn't say it. She only folded the paper into quarters and slipped it into her pocket, then cleared away the tray and wished him good night. And at the doorway, she turned back and added that she would come in at 7 the next morning, and if he didn't want her to enter, he could simply lock the door and she would wait in the hallway. That night she lay awake in the room at the end of the west hallway, far longer than she had expected. At 7 the next morning, the door wasn't locked. But before she could make it upstairs, Vivian Vale was already waiting at the foot of the staircase with a stack of papers in her hand. She handed Sonia a 2-page printout and called it the household rules. Don't touch the medical records. Those are kept by the doctor's office. Don't contact any outside physicians. All medical concerns are to be reported to Dr. Roth. Don't take anything from inside the house outside. All caregiving notes must be turned in at the end of every shift. Sonia read both pages completely, then looked up and said she agreed with the first 3 conditions, but not the 4th, because her nursing notes were records for which she was personally responsible under her professional license, and if something went wrong, she would be the one standing in court, not anyone else. Vivian didn't respond to that. She only smiled and said that, of course, she wasn't familiar with those procedural details. Then she took a thin white envelope from between the papers, no thicker than a few sheets folded in half, and placed it in Sonia's hand. She called it a private allowance. She said the work here was harder than outsiders imagined, that the Vale family had always known how to take care of people who did good work, and that this money was separate from Sonia's salary, paid in cash, with no need to report it anywhere. Sonia held the envelope in her hand and waited, because she knew Vivian wasn't finished. And Vivian continued, still speaking in that same warm voice without changing a single note, saying that Marcus had been writing strange things lately, that it was part of his condition, that some of what he wrote could be badly misunderstood by people who didn't know him. So if he wrote anything for Sonia, she should simply let Vivian see it first, or even just take a picture of it, so the doctor could monitor his progress. The envelope was very light. Sonia didn't open it. She placed it gently back into Vivian's hand without shoving it at her, and said she didn't accept money to spy on her patients, and that if the doctor needed to know what Marcus was writing, the doctor could ask him directly. Vivian didn't get angry. Not a single muscle in her face shifted. She took the envelope back, slipped it between the 2 pages, gave Sonia one very polite nod, then walked 3 steps before stopping and turning her head. Miss Marchetti, the 14 people before you all took this envelope. She let the sentence hang in the air for exactly 1 beat. So why do you think they were still fired? That question followed Sonia for 2 days, and she found half the answer in the kitchen on the afternoon of the 3rd day. The housekeeper, Gloria Pace, was stacking dishes when Sonia casually asked how long the woman before her had worked there. Gloria didn't answer right away. She looked toward the kitchen door, then lowered her voice to the level Sonia had already learned was reserved for things that weren't supposed to be discussed upstairs. Her name was Bridget. 4 months, the longest of any of them. They called a car for her at 2 o'clock in the morning. No one was allowed to say a word to her. No one was allowed into the foyer. We only heard the suitcase wheels dragging over the gravel, and then it was over. Sonia asked what she'd done wrong. Gloria shook her head and said she didn't know, and that it mattered less than what happened afterward. 3 days after Bridget left this house, someone filed a complaint with the state education department, accusing her of violating patient privacy. The complaint was eventually dismissed, but it stayed in her professional record, and in New York, any human resources department could find it. Bridget didn't lose her license. She only lost every place that might have hired her. Gloria set down the stack of plates and said the last thing she would say about it. In this house, they don't fire you, Miss Marchetti. They erase you. That night, Sonia lay awake for a long time with those 2 words in her mind, and the next morning she did the only thing she was permitted to do. She didn't touch the medical records, exactly as the rules required. She asked to see the care schedule, something any nurse responsible for a patient had the right to review for shift handoff, and the office gave her a thick plastic binder containing the notes of the 14 people who had come before her, arranged by date, not a single page missing. She took the binder back to her room and began reading from the first page. Most of it was the kind of dull notation she had written 1,000 times in her life. Blood pressure, temperature, how much of a meal he had eaten, how many hours he had slept. But when she reached page 11, she stopped, and she took out a pencil. At regular intervals, there was a line written in a different hand, brief and without explanation. Steroid injection, Dr. Roth. She went back, found the first entry, then began marking them one by one. There were 5 such entries over 11 months. She took a blank sheet of paper, drew a horizontal line, marked 5 points along it, and counted the distance between them in days. 70 days, 70 days, 71, 70, 70, 10 weeks, 5 times in a row, never off by more than a single day. Sonia sat staring at that line for quite a while. A schedule that regular wasn't unusual by itself. Treatment protocols often followed cycles. The unusual part was somewhere else, and she only found it when she went back and read the nursing notes from the days immediately following each injection. After the first one, a nurse had written that the patient choked on water twice during breakfast on the 4th day. After the second, someone else noted difficulty swallowing and a change to soft food beginning on the 3rd day. After the 3rd, there was only one short line: shallow breathing, required rest midway while climbing stairs, 5th day. After the 4th, choking again, difficulty swallowing again, once more between the 3rd and 5th day. After the 5th, the note belonged to Bridget, and her handwriting was much smaller than usual, as though she had written it quickly. Patient choked while drinking water, coughed without sound, remained upright throughout meal. Sonia put the pencil down. She had been doing this work for 6 years, and she didn't need to look anything up to know one very simple thing that anyone who had ever spent time in a hospital already understood. Steroids were given to make a patient better. That was the entire reason for giving the injection in the first place. If it worked, the patient breathed more easily, swallowed more easily, inflammation went down. If it didn't work, the patient stayed the same. What it didn't do, not once in the 6 years Sonia had stood beside hospital beds, was make someone worse in exactly the same way, within exactly the same span of time, over and over again, 5 times in succession. Once was coincidence, twice was bad luck. 5 times, exactly 70 days apart, with the same sequence of symptoms appearing in the same order, wasn't illness anymore. It was a chart. Sonia closed the plastic binder and sat still in the room at the end of the west hallway, both hands resting on her knees, and she allowed the thought to go where she had been trying to keep it from going for the past 2 days. She didn't know what was inside those syringes. She had no way of knowing, but she knew one thing with absolute certainty, as surely as she knew her own name, that whatever it wasn't a steroid, and the person who had written those 2 words into the care schedule 5 times in a row either had no idea what they were injecting or knew exactly what they were doing. Then she looked again at the line with 5 marks on the blank sheet of paper, counted backward from the final mark to the present day, and felt her hands turn cold. The 6th injection would come in less than 3 weeks. The next morning, Sonia entered the study at 7 o'clock with a small flashlight in her pocket and no plan beyond looking. Marcus Vale was already seated in the armchair, his back straight, both hands resting neatly on his thighs, exactly as he had been on the first morning and every morning she had seen him since. Vivian stood by the window with a cup of coffee, and it was the first time since Sonia's arrival that she had been there at this hour. Sonia set the plastic binder on the table, pulled her chair closer, and said, "Mr. Vale, I'd like to examine your throat. It should take about 1 minute. I won't touch you except to hold your tongue down with a depressor, and if you feel uncomfortable, raise your hand and I'll stop immediately. Do I have your permission?" Marcus nodded. Sonia took out the flashlight, switched it on once so he could see the beam, then sat on the low chair across from him. By the window, the coffee cup settled onto its saucer with a soft sound. Vivian said that Dr. Roth had already examined him very thoroughly, that he examined him every week, and that there was nothing new to find. Sonia replied, "Yes, ma'am," then continued speaking to Marcus. "Open your mouth for me, please, and try not to stick your tongue out. Just let it rest where it is." She slid the tongue depressor into place, adjusted the angle of the light, and began to look. The mucous membranes were pink, moist, and evenly colored. No redness, no swelling, not a single white patch. She moved the beam along the right side of his throat, then the left, and saw no trace of anything that had ever been inflamed or had ever healed. No scarring, no mass, nothing at all. She had looked into the throats of hundreds of people over 6 years, and she could say without hesitation that this was a healthy throat, healthier than the throats of most people outside who were speaking normally every day. Vivian stepped 1 pace closer. Her voice didn't get louder, but its rhythm changed. "Miss Marchetti, I think we should leave this to the doctor. You're a nurse. You're not a physician. You're exceeding your role." Sonia didn't look up. Her eyes never left the beam of light. "Yes, ma'am," she said. "I'm a nurse, but nurses are trained to look." Then she spoke to Marcus. "Hold still for me, sir. Just 10 more seconds." She lowered the beam slightly. "Form the sound ah for me, please. You don't need to make any sound. Just make the motion." Marcus opened his mouth wider and did exactly that. And there, at the soft palate in the back of his throat, Sonia saw the only abnormal thing in the entire examination. The right side lifted normally. The left side rose more slowly, stayed lower, failed to keep pace, pulling the midline slightly off to one side. Not much, just enough for someone who knew what to look for to notice. Sonia removed the tongue depressor, switched off the flashlight, and set it on the table. She straightened in her chair and said nothing for several seconds. Inside the plastic binder beside her elbow was the diagnosis she had read over and over for 2 nights. 3 neat words near the bottom of a page bearing the clinic's letterhead: conversion disorder, psychogenic aphonia. Then Sonia spoke, and her voice was so ordinary that its very ordinariness made everyone in the room pay attention. "Mr. Vale, could you cough for me once?" Vivienne said that was enough, but Marcus was looking directly into Sonia's eyes, and he didn't look at anyone else. He inhaled, his chest rose, then jerked downward in one sharp, decisive motion, exactly the movement of a real cough. His shoulders pitched forward, the muscles on both sides of his neck tightened into 2 clear lines beneath the skin, and his abdomen pulled inward as the air was forced out. Sonia saw every part of it happen less than an arm's length away, but there was nothing. Not a hoarse sound, not a rasp. Not even the faint little burst of sound a throat usually makes, even when a person is utterly exhausted. There was only the sound of air passing through, hollow and empty, like wind moving through a pipe. Marcus coughed a second time without being asked. Then a third, still the same. In the silence afterward, Sonia clearly heard the coffee cup touch the saucer again near the window. She stood, and when she spoke, she addressed Vivienne, though her eyes never left the man sitting in the chair. "Ma'am, the paper in that binder says he lost his voice for psychological reasons. I've cared for patients like that. They can't speak, they can't sing. Some of them are even afraid to try, but they cough with sound. Every one of them coughs with sound, because a cough isn't speech, it's a reflex, and no one controls a reflex with fear." She paused. "A psychological condition can't take away a person's cough. This can." Vivienne set her coffee cup down on the table and said she thought Sonia should end her shift early that day and get some rest. Her voice was still warm. Not a single muscle in her face moved out of place. But Sonia wasn't looking at her anymore. Sonia was looking at Marcus Vale, and Marcus Vale was looking back at her, and there was no surprise in his eyes. None at all. That wasn't the expression of a man who had just heard something new. It was the look of a man who had known this for a very long time, who had known it before she ever walked into this house, and who had spent all that time sitting in silence, waiting to see whether anyone would finally be willing to say it for him. Sonia didn't end her shift early. She worked through the rest of that day as though nothing had happened that morning, and Vivienne did the same, and the 2 women in that house remained so relentlessly polite to one another that the air in the hallways began to feel difficult to breathe. Close to 11 o'clock that night, as Sonia passed the study on her way downstairs to the kitchen for a glass of water, she heard a sound. 3 knocks, metal against wood, even and unhurried, each one separated by exactly 1 beat. She stopped. 3 more knocks. She pushed the door open and found Marcus Vale sitting at the writing desk beneath the only lamp still burning in the room, the ring on his 4th finger just lifting away from the surface of the desk. He didn't look at her right away. He pulled a blank sheet of paper toward himself, picked up a pen, and began to write. Sonia closed the door behind her and walked over to stand beside the desk, and she didn't ask a single question while he wrote, because this was the first time in 5 days she had seen this man write something that wasn't an answer to someone else's question. He wrote longer than she expected. Then he pushed the paper toward her. "I've written it down 3 times already. All 3 times, it was taken out of this room before sunrise. All 3 times, it was turned over to the doctor as evidence that I was delusional." Sonia read the entire note, then read it again. She set the paper down on the desk and lowered herself into the chair across from him, slowly, so he could see clearly that she intended to stay. Then she asked, "What did you write on those 3 pages?" Marcus Vale didn't answer immediately. He looked at her for a long time, and Sonia saw something in his expression being weighed and reweighed, the way a person weighs a decision they have considered many times before, without ever quite reaching the end of it. Then he pulled another sheet toward himself, and he wrote. He wrote only 1 word. Sonia didn't have time to read it, because the instant the pen left the paper, he tore the sheet from the pad folded it in half, then in half again, and before she could say a single word, he put it into his mouth and swallowed it. He did it neatly, without panic, without glancing around, exactly the way someone performs an action they have planned for a very long time. Then he reached for the glass of water on the desk, took a sip, set it back down, and pulled the next sheet of paper toward himself. Sonia sat perfectly still. In 6 years of nursing, she had seen many things that could keep a person awake at night, but never before had she watched a man sit so straight and composed while doing something like that. Marcus wrote on the new page, and this time he wrote very quickly. Don't know. Knowing gets you killed. He pushed the paper toward her, then set down the pen and looked toward the black window behind her. Sonia picked up the note. She was about to say that she wasn't afraid, but she realized immediately that it would be a lie, and he would know at once that it was a lie. So she said something else instead. Mr. Vale, I understand, but you've written it 3 times, and 3 times they managed to take it away. That means writing it down doesn't work. She folded the paper and slipped it into her pocket beside the first note he had ever given her. So this time we'll try something different. You don't have to tell me anything. You only have to give me permission to do my job properly, and I'll find out for myself. Marcus Vale turned and looked at her. He didn't nod, but he didn't shake his head either, and he picked up the pen, and he wrote the final line of that night in handwriting noticeably slower than on the previous 3 pages. If you search, don't search inside this house during the day. During the day, everyone is watching. Sonia wished him good night and left. She returned to the room at the end of the west hallway, closed the door, and didn't turn on the light. She sat on the edge of the bed in the darkness, took out her phone, and typed into the search bar the exact question that had been forming in her mind since that morning, the question she hadn't dared to type all day. What substance can paralyze the vocal cords without leaving damage? The first result appeared in less than a second. Sonia read the short summary at the top of the page all the way through, then read it a second time, and when she reached the part saying that its effects lasted approximately 10 weeks, she stopped. She didn't read any farther. She turned off the screen and placed the phone face down on the bed. In her mind, she saw the blank sheet with the horizontal line and the 5 marks along it, 5 marks spaced exactly 70 days apart, and she sat there motionless in the darkness for a very long time, both hands resting on her knees, until she heard the clock downstairs strike 12. Then one more thought came to her, and this one was colder than everything that had come before it. Marcus Vale hadn't written those 3 pages for her. He had written them before she ever set foot inside this house. So where were those 3 pages now, and who was keeping them? Sonia waited 2 more days before seeking out Arthur Kessler, and she found him in the only place in the house no one else seemed to visit, the small room beside the foyer, where he sat from morning until night, with a ledger and a landline telephone. She closed the door behind her and laid everything out in exactly 4 minutes. She told him about the 5 entries in the care schedule, about the 70-day intervals, about the same sequence of symptoms appearing between the 3rd and 5th day after every injection. She didn't name any substance. She only said that whatever was being injected into his employer wasn't what the paperwork claimed it was. Arthur Kessler listened to all of it without interrupting once, both hands resting on the desk. Then he said, "Miss Marchetti, I'm going to answer you once, and then I'm done. Dr. Emmett Roth has treated this family for 20 years. He was at the hospital the night Mr. Marcus's father died. I know his medical license number by heart because I've been the one signing his invoices all these years. You arrived here last week." He opened the ledger, turned 1 page, then closed it again without reading anything. And Sonia understood that the gesture existed only to show her that he had a file on her in there. "I know why you took this job. I know there's a complaint in your professional record. It was dismissed. I know that, but it's still there. And it's the reason a nurse with 6 years of experience is working hourly shifts for a private nursing company instead of standing in a respectable hospital." He looked up at her. "People in your position find conspiracies very easily, Miss Marchetti, because conspiracy is the only thing that explains how their lives ended up the way they did." Sonia didn't argue with a single word. She didn't mention the complaint, didn't tell the old story again, didn't say that she had been right. She simply sat still until he was finished, then said, "Mr. Kessler, I'm not asking you to believe me. I'm asking you for 10 minutes. Come with me into his room. I won't say a word. You only need to place your hand in one place, and you can draw your own conclusion." Arthur Kessler looked at her for a long time. Then he stood. Marcus Vale was sitting at the writing desk when the 2 of them entered, And he looked first at Arthur, then at Sonia, and Sonia gave him a small nod. She said, "Sir, I need to do something, and I need to touch your neck, and Mr. Kessler will need to as well. Do you give us permission?" Marcus looked toward the man who had stood beside his father for 30 years, then nodded. Sonia pulled a chair over and told Arthur to sit across from him. Then she lifted Arthur's right hand and placed his palm against the front of Marcus Vale's throat, directly over the cartilage rising beneath the skin, and she held his hand there with 2 fingers. He wasn't used to this, and his hand went rigid. Sonia said, "Relax your hand. Don't press. Just let it rest there." Then she turned to Marcus. "Sir, don't try to speak. Just hum one sound, the way someone makes a low sound in the back of the throat. Hold it for about 3 seconds, and try as hard as you can." Marcus Vale inhaled. Sonia saw his shoulders lower, then his chest expand. She saw the muscles on both sides of his neck rise into 2 clear bands beneath Arthur's palm, saw the area beneath his chin tighten, saw his jaw clench with effort, and even saw the pulse at his temple quicken. The man's entire body was doing exactly what a body was supposed to do when producing sound. Air came out, and she could clearly hear it passing through his lips. 3 seconds passed, then 4. Then Marcus emptied his lungs and sat upright again. Arthur Kessler didn't pull his hand away. He left his palm exactly where it was and stared down at it as though it had just told him something he didn't want to hear. Sonia released her 2 fingers and took the phone from her pocket, opened a video she had downloaded the night before, a clinical recording of a patient who had lost her voice for psychological reasons, and showed him exactly 15 seconds. In the video, a hand rested against the patient's throat in the same way. The patient couldn't speak a single word, but when she hummed, her vocal cords vibrated, and that vibration was plainly visible on the screen, and the hand resting on her throat moved with it. Sonia turned off the screen. She didn't say another word, exactly as she had promised. Arthur Kessler sat there for a long time, with his hand still resting against Marcus Vale's throat, and the 61-year-old man suddenly looked every year of his age, perhaps more. Then he drew his hand back, placed it on his thigh, and said without looking at anyone, "For 11 months, I've been sitting right outside that door." He paused, and I haven't heard a thing. Marcus Vale reached for a sheet of paper, wrote 1 short line, and pushed it toward Arthur. The older man read it, folded the paper, and slipped it into the breast pocket of his shirt. And when he stood, his voice was nothing like the voice of the man who had been sitting in that small room beside the foyer 4 minutes earlier. "Miss Marchetti," he said, "come downstairs to see me at 7 o'clock tomorrow morning. There are a few things about the 14 people who came before you that I think it's time you knew." At 7 o'clock in the morning, Arthur Kessler was already sitting there with a flat tin box on the desk. He opened the lid and poured out a small stack of papers, uneven scraps torn by hand, and arranged them in a row in front of Sonia. Each scrap contained only 1 handwritten word, in the same large, square lettering she recognized immediately. "Out." She counted them. There were 14. Arthur said, "You asked me yesterday why the 14 people before you were fired. This is the answer. Mrs. Vale didn't fire them. He did. Every single one of them. And I was the one who carried the note downstairs each time." Sonia stared at the scraps for a long while. She asked what they had done. Arthur began pointing to them one by one. The second person took the envelope and photographed every page of the nursing notes. The 5th stood in his room and spent 20 minutes on the phone with her husband, talking about how the owner of this house probably wouldn't live until Christmas, saying it right in front of him, standing exactly 3 steps away. The 8th secretly took a picture of him while he was sleeping and sent it to someone. We never found out who. The 11th gave him his medication by forcing his jaw open, the way people give medicine to a dog. He stopped and gathered the scraps back into a stack. "Miss Marchetti, you think they were fired because they weren't good at their jobs. They weren't. 3 of them had higher qualifications than you do, and 1 had spent 15 years working in the intensive care unit of a major hospital in Manhattan. They were fired because they walked into that room and looked at him as though they were looking at an empty chair. He couldn't speak, so they gave themselves permission to treat him as though he wasn't there anymore." Sonia asked about Bridget. Arthur was silent for a moment, then said Bridget had been the best of the 14, that she had lasted 4 months, and that she was fired because she called an outside doctor without telling anyone. Mr. Marcus wrote that note. Yes, but the complaint filed with the state education department 3 days later wasn't his doing. He didn't know about it. I'm certain of that, because I didn't know either until Mrs. Vale's lawyer sent me a copy to keep on file. He rested one hand on the lid of the tin box. She didn't do that because of Bridget. She did it so the other 13 would hear about it, and so the 15th person would hear about it too. Sonia asked who had hired her. Arthur looked directly into her eyes, and he answered slowly, like a man who knew the sentence he was about to speak would remain with her for a very long time. The 14 before you were all sent by the nursing agency at the request of Dr. Roth's office. You're the only one, Mrs. Vale chose herself. She reviewed 3 files, crossed out 2, and circled your name. He let a beat pass. Miss Marchetti, out of those 3 files, yours was the only one with a complaint in your professional record. Sonia said nothing. She sat perfectly still and felt something very cold move down her spine, not because she was afraid, but because she had just understood that the black mark that had ruined her career wasn't the reason she had almost failed to get this job. It was the reason she had gotten it. If she ever opened her mouth and said anything about this house, all they had to do was pull out that complaint, and no one in the world would believe her. She had been chosen because she was exactly the kind of witness who could be erased with a single sheet of paper. The conversation ended there, because they heard a car on the gravel. Danny Vale entered the house without knocking, 32 years old, moving quickly and speaking loudly, and he went straight to Arthur in the middle of the foyer without even bothering to step into the room. He said the board had waited long enough. He said people outside were beginning to talk, that some things couldn't be run on handwritten notes, that the partners in Delaware had asked 3 times this month, and he no longer knew what to tell them. Arthur replied in his steady voice that until the boss gave the signal, no one was holding any meeting. Danny said, "What boss? Look in there and see for yourself." Then stopped in the middle of the sentence, turned his face away, and struck his fist lightly into his palm once. He said he loved his brother more than anyone else in this house, and that was exactly why he was the only person willing to tell the truth. Then he headed for the door. Sonia was standing at the end of the west hallway, with a stack of clean towels in her arms, and Danny walked past without seeing her, his phone already pressed to his ear. He lowered his voice, but not quite enough. 4 more weeks, he said. Keep everything exactly where it is. Don't touch anything. 4 weeks from now, it all comes to me. Then the door closed, and the sound of the car rolling over the gravel faded away. Sonia remained exactly where she was with the towels in her arms, thinking about the blank sheet of paper with 5 marks spaced 70 days apart, and she counted backward one more time. 4 weeks. Exactly the amount of time left before the 6th injection. Sonia took the 11th day off and told the office she needed to go back to Queens to pick up some belongings. She took the train into Manhattan and went to an ear, nose, and throat clinic on 72nd Street, where she had made an appointment 2 nights earlier under her real name and paid out of her own pocket. Dr. Helena Braun was 48 years old, worked independently, had no affiliation with any hospital, and listened to Sonia's entire 10-minute account, without writing down a single word. Sonia presented it in the exact order of a nursing handoff. Male patient, 38 years old, complete loss of voice for 11 months. Sudden onset over the course of a few days. Throat mucosa normal. No inflammation, no scarring, no mass. Soft palate elevated unevenly on one side. Cough produced no sound. No vibration could be felt over the larynx when the patient tried to hum. Imaging and blood work were all clear. Regular injections had been given, documented as steroids, and 3 to 5 days after each injection, the patient choked on water, had difficulty swallowing, and developed shallow breathing. Helena Braun waited until Sonia had finished before asking one question, and only one, about the cough. You're certain there was no sound at all? Not hoarse? Not faint? But none? Sonia said there was none. Dr. Braun leaned back in her chair and looked up at the ceiling for several seconds. Then she said, Miss Marchetti, I'm going to tell you something I won't put into any official paperwork today, because I haven't examined this patient. But if everything you just told me is accurate, then this isn't an illness. For a person's vocal cords to produce sound, they have to close and vibrate as air passes through them. That closure is controlled by a very small group of muscles inside the larynx. If those muscles are paralyzed, the vocal cords remain open. Air passes between them without striking anything, and what you get is exactly what you described. Not hoarseness. Emptiness. She picked up a pen and drew 2 short parallel lines on a sheet of scrap paper. There is a toxin that can do exactly that, called botulinum toxin. We use it in very small doses to treat certain voice disorders, injected directly into the vocal cord muscles with an extremely fine needle. And it's a legitimate procedure performed every day in many clinics. But dosage is everything. A large enough dose, injected into the right place, can cause those muscles to stop functioning completely. She set down the pen. And this is the part that would keep me awake at night if I were you. It doesn't destroy anything. It only interrupts the signal. So a CT scan shows nothing, an MRI shows nothing, and blood tests show even less, because by the time anyone thinks to test for it, there is usually nothing left in the bloodstream to find. The patient can travel all over the world, and every doctor will tell him the same thing, that there is nothing physically wrong with him, and because they can't find an organic cause, someone eventually writes in the chart that the cause is psychological. Sonia asked how long it lasted. Helena Braun said, "That's the crucial point. The effect isn't permanent. The muscle gradually recovers, and the patient's voice returns after roughly 10 to 14 weeks, sometimes sooner, sometimes a little later. That's why in medicine we have to repeat the injections for patients who genuinely need them." She looked directly into Sonia's eyes. So if someone has remained voiceless for 11 straight months without a single day of improvement, there is only one explanation. Someone is injecting him again. Sonia sat motionless. Dr. Braun asked how many weeks apart the injections were. Sonia said 10 weeks. Helena Braun said nothing for so long that Sonia could hear the clock ticking on the wall. Then she spoke, each word separated from the next. "Miss Marchetti, no doctor accidentally gives the wrong injection 5 times in a row, exactly 10 weeks apart." She pulled a sheet of paper toward herself, wrote out 1 page by hand, signed it, stamped it with the clinic seal, and handed it to Sonia. "This is my professional opinion regarding the symptoms as described, with no patient named. Keep it. I don't know what you've gotten yourself into, and I'm not going to ask, but keep this somewhere that isn't inside that house." Sonia folded the page into quarters and slipped it into the inner compartment of her handbag. She thanked her, paid the consultation fee in cash, and left. She started walking toward the subway station, and had gone about 1 block when a very old feeling returned to her, the same feeling she had known 3 years earlier while waiting for the outcome of that complaint, the feeling that someone was staring at the back of her neck. She stopped in front of a store and looked into the glass. Behind her, about 65 feet away, a black sport utility vehicle was creeping along the curb at the speed of someone walking, on a street where every other car was honking to get around it. Sonia kept walking. The vehicle kept moving. She turned right at the corner, and in the glass of the building across the street, she saw it turn after her. She went down into the subway station, stopped at the bottom of the stairs, and stood there for a long moment, with one hand resting over the inner pocket where Dr. Braun's letter was hidden, thinking about one very simple thing she had overlooked all morning. She had told the office she was going back to Queens to pick up her belongings. She had never told anyone in that house that she was going into Manhattan. Sonia didn't go straight back. She boarded a train, got off at the second stop, stood there for exactly 4 minutes watching the flow of people, then boarded a train going in the opposite direction, and got off at another station, before changing lines one final time. By the time she reached Oyster Bay, it was already dark, and she entered through the kitchen door. The room at the end of the west hallway looked exactly as it had when she left that morning, and that was the first thing that made her stop in the doorway. She had left in a hurry, and she remembered very clearly that she had draped her coat crookedly over the back of the chair. Now it was neatly folded. She stepped inside without turning on the main light, and moved from one end of the room to the other as though inspecting a scene during a shift handoff. The drawer was closed more tightly than she had left it. The shoes beneath the bed were lined up parallel to each other. And on the desk, her nursing notebook lay exactly where it had been, except the lower right corner of the cover, the corner she always kept flush with the edge of the desk out of 6 years of habit, now extended about 3/4 of an inch beyond it. She picked it up and turned through every page. Nothing was missing. Nothing was torn. Nothing had been taken. And she understood immediately that this was worse than having something stolen, because people only returned a notebook to its original place like that after they had finished photographing every page and wanted her never to know. Beside the notebook was an envelope. Sonia stared at it for a long time before touching it. It wasn't thick. She opened it, and there was no money inside, only a printed page, a statement from the collections department of a hospital in Queens, the patient's name Teresa Marchetti, the date of her final discharge 3 years earlier, and at the bottom, the amount of $61,000 along with the number of months overdue. In the margin, written neatly in blue ink, unsigned, were 6 words, "Can be cleared in 1 day." Sonia sat down on the edge of the bed and remained there for a very long time with the paper in her hand. No one in New York knew that number except her and the collection agency. She hadn't told the nursing company, hadn't put it on any application, hadn't told a single friend. Yet here it was, cleanly printed and placed on her desk inside this house. The next morning, Vivian invited her into the small sitting room on the 2nd floor and poured her a cup of tea that Sonia never touched. Vivian said she wanted to apologize for what had happened in the study that morning, that she had been under stress, that she knew Sonia was only doing her job. Then she placed a thin file on the table and opened it to the final page. It was a sworn affidavit. Sonia skimmed it and recognized the structure immediately because she had signed similar documents in hospitals, except the content was different. The declarant affirmed that during the course of direct care, she had observed that the patient was incapable of understanding or making decisions concerning his own affairs, frequently displayed signs of confusion, and wrote statements inconsistent with reality. Beneath it was a blank line for a signature, name, and professional license number. Vivian said very gently that it was only a formality, that the court needed confirmation from someone directly involved in his care, that this was really meant to protect him, to keep outsiders from taking advantage of him in his present condition. Then she said the rest. Her mother's debt would be paid in full the same day Sonia signed, with the family's lawyers handling everything. In addition, there would be $200,000, transferred legally and recorded as a long-term care consulting fee, with a contract and proper tax reporting. She closed the file and pushed it toward Sonia along with a pen. "Miss Marchetti, I know how many shifts you've worked every week for the past 3 years just to pay the interest on that debt. I know you're paying $190 a month in installments, and you'll still be paying when you're 60. This ends in 1 afternoon." Sonia looked at the pen. She didn't pretend she didn't want it. In her mind, she could see with painful clarity that afternoon 3 years earlier in the hospital finance office, when someone slid the paperwork through the glass for her to sign while her mother's body hadn't even been taken down to the morgue yet. And she remembered standing there doing the arithmetic in her head, trying to calculate how much debt one human lifetime could ever repay. She remembered the feeling in her chest, too. The silence in that small room lasted so long that Vivian had to lift her teacup and set it down again. Then Sonia pushed the file back to the middle of the table and laid the pen horizontally across it. She said that the affidavit was asking her to certify something she had personally observed to be false, and that if she signed it, she wouldn't only be lying to the court, she would be lying with the professional license she had spent 6 years fighting to keep. Vivian didn't become angry. She only straightened in her chair and looked at Sonia with the expression of someone rechecking a calculation and unable to understand where the mistake had occurred. Then she said softly, almost with pity, "You're poor, Miss Marchetti." Sonia stood, picked up her bag, and answered with exactly 1 sentence before leaving the room. "Yes, ma'am, but poor doesn't mean for sale." 2 days later, at nearly 9 o'clock in the evening, Sonia received a message from the office saying that Dr. Roth would arrive within the hour to administer the regular injection. She read the message twice, then opened the sheet of paper with the 5 marks on it. There were still 13 days left before it was due. They had moved it forward by 2 weeks. She went downstairs first, found Arthur Kessler, and told him only one thing, that he should be present in the study that night, and he didn't ask why. Emmett Roth arrived 10 minutes before 10, 55 years old, carrying a small medical case, and the manner of a man who had walked this path hundreds of times before. Vivian greeted him in the foyer. Marcus Vale sat in the armchair in the study in rigid silence, his posture upright, and his unblinking gaze tracking every movement as they walked in. Roth set the case on the table and opened the locks. Sonia stepped forward and said, "Doctor, I'm the nurse responsible for this patient. Before you give the injection, I need to see the vial, read the name of the active ingredient, the concentration, the lot number, and the expiration date, and I need to record that information in my nursing notes and sign my name. That's procedure. I would do the same with any injection given to any patient under my care." Roth's hand stopped on the lid of the case. He said he was the treating physician and didn't need a nurse to approve his medication. Sonia replied that she wasn't approving anything. She was documenting it, and that if anything happened within 48 hours after this injection, the first person anyone would question would be her, not him. Roth said that if she wasn't satisfied with the way things were done here, there were plenty of other nurses. Sonia didn't move. She said, Then I'll document that the nurse responsible for the patient requested to inspect the medication and was refused. I'll record the exact time, and I'll sign my name beneath it. Would you like me to write that, doctor? Vivian stepped between them, and for the first time since Sonia had entered this house, her voice broke out of the warm, measured rhythm she had maintained all along. She said that was enough, that Miss Marchetti had been hired to take blood pressure readings and administer medication, not to interrogate a doctor who had cared for this family for 20 years, and that if Sonia wanted to keep this job, she needed to step back immediately. Her voice rose slightly. Only slightly. But in that room, it sounded like a glass shattering. And while everyone was looking at her, Marcus Vale rose from his chair. No one heard him stand. They only realized he had when his shadow stretched across the floor. He walked 3 steps to the writing desk, picked up a pen, wrote exactly 1 word on the top sheet of paper, then tore the page free and handed it to Arthur Kessler. He didn't give it to Roth. He didn't give it to his wife. He gave it to the man who had served this family for 30 years, exactly the way every order in this house had always been passed down. Arthur took the paper. He read it, and Sonia watched the color drain from the older man's face in less than a second. He folded the page, slipped it into the breast pocket of his shirt, then turned to Dr. Roth with the voice of a man reading a decision, not negotiating one. Dr. Roth, close your case and leave this house right now. You will not return until further notice. The boss says no. Emmett Roth looked at Arthur, then at Vivienne, then at the man standing in the middle of the room. No one said anything else. No one touched anyone. Roth closed the medical case, snapped both locks shut, and carried it toward the door with steps slightly faster than necessary. Vivienne followed him into the foyer, and Sonia heard her say something very quietly out there. Then the front door closed. Then came the sound of the car. 3 people remained in the study, and for a long while none of them sat down. Arthur Kessler was the first to move. He walked up to Marcus Vale and bowed his head, a very brief and very old gesture, the kind of salute Sonia guessed he hadn't used in nearly a year. Then he said he would have someone guard the gate that night, and he left. Sonia gathered the records and was about to wish her employer good night when Marcus raised one hand, signaling for her to wait. He sat down at the writing desk, pulled a fresh sheet of paper toward himself, and began to write. He wrote longer than he ever had before. Then he pushed the page toward her. For 11 months, I haven't been able to give a single order. People still ask for my opinion, still nod, then still do things their own way. Today, I gave an order. Not because I'm stronger than I was yesterday, because there was one person in the room willing to read what I wrote. Sonia finished reading, folded the paper with great care, and slipped it into her pocket beside the other 2 notes. She thanked him, wished him good night, and stepped into the dark hallway. But she didn't return to her room immediately. She stopped beside the window and looked out toward the gravel drive where Roth's car had just disappeared, and she thought about something no one in that room had said aloud. That injection had been stopped, but the previous 5 hadn't been, and if the man inside that room was about to begin recovering, then whoever had been injecting him knew it too, and now they had very little time left. Marcus had written to her that everyone watched during the day, so Sonia waited until 3 o'clock the next morning. The private clinic was in the eastern basement, a small room lined with white tile the doctor's office used whenever Roth came, and its door was secured by an electronic keypad. Sonia knew the code because she had stood beside Gloria exactly once when the woman went downstairs to get bandages. She entered the numbers, the door opened, and she closed it behind her. The medical refrigerator stood against the wall on the right, a small unit with a temperature display on the front. 39 degrees Fahrenheit. Sonia opened it. Inside were several boxes of ordinary medications arranged neatly, and on the middle shelf, separated in a plastic tray, were 6 small glass vials. She picked one up and turned the label toward the light. Methylprednisolone, 40 milligrams per milliliter. Sonia stood perfectly still for a long time with the vial in her hand, and in 6 years of nursing she had never seen anything so simple feel so cold. She had drawn this medication from a vial no fewer than 100 times. It belonged in a medication cabinet at room temperature beside boxes of gauze, exactly as the words printed on the label in her hand indicated. No one kept it in a refrigerator, not because it was forbidden, but because there was simply no reason to, just as no one kept sugar in a freezer. Yet these 6 vials were sitting inside a refrigerator at 39 degrees Fahrenheit, separated in their own tray, and they had been there long enough for condensation to form on the glass when she brought one out. Then she looked more closely. The rubber stopper sealing the vial was pale gray. The kind she had used throughout her career had a different colored stopper, and she knew that as surely as she knew the color of her own notebook cover. Sonia placed the vial on the metal counter, took out her phone, and began taking pictures. She photographed the label first, then all 6 vials in the tray, then the temperature display on the refrigerator door, and finally one image that included both the refrigerator and the room number printed on the wall, so no one could later argue about where the photographs had been taken. Then she opened the drawer beneath the counter. Inside was a stack of papers fastened together with a metal staple. She turned them over and found medication delivery receipts, 1 page for each delivery, 6 pages arranged by date. At the top of every page were the prescribing doctor's name and Emmett Roth's medical license number, already printed. At the bottom was a line for the person receiving the shipment to sign, and on all 6 forms, written on that line, were the same 2 handwritten words. M. Vale. Sonia bent closer beneath the light. She had been reading that man's handwriting every day for the past 2 weeks, and 3 of his notes were in her pocket at that very moment. Large square letters, firm downward strokes, a broad open V. The handwriting on these receipts was smaller, rounder, and the final stroke of the E curled upward. It looked similar enough for a delivery employee to glance at it and accept the signature. It looked nothing like the writing on the 3 notes in her pocket. Sonia photographed all 6 receipts, 1 page at a time. She was taking a picture of the last one when the lights went out. They didn't flicker. They simply died all at once, plunging the entire room into thick darkness, and at the same moment she heard a faint click near the door, the sound of the electronic bolt sliding into the frame. Sonia didn't scream. She stood completely still for exactly 5 seconds, while her eyes began adjusting, then turned on the flashlight on her phone and walked to the door. The keypad was dark. She pressed it, but not a single light appeared. She tried the door handle, and it didn't move. She checked her phone. There were no signal bars, and then she remembered that there had never been reception in this basement. Then she looked up at the small camera mounted in the corner of the ceiling above the door. Its indicator light had just changed from red to green. Sonia stared at it for a while. Then, she switched off her flashlight to conserve the battery, went back to the counter, sat down on the floor with her back against one of the metal legs, drew her knees up, and wrapped her arms around them. She had worked night shifts in an emergency department for 3 years, and she knew exactly what happened to a person when panic began taking over inside an enclosed space. The heart rate climbed, breathing became shallow, body temperature dropped faster. So she did the opposite. She counted her breathing, 4 counts in, 6 counts out, and continued until her hands stopped trembling as much. Then she thought about the photographs on the phone inside her pocket. She thought about how whoever had locked that door knew she was there and knew what she had photographed, and that if they wanted the phone, they could have come inside and taken it already, which meant the fact that they hadn't entered meant they didn't want anyone seeing their face in that room tonight. She thought about the man sleeping upstairs, the man who had sat with his back straight for 11 months inside a house where everything he ate, everything he drank, everything injected into his body passed through someone else's hands. 4 hours passed that way. The cold crept gradually upward from her feet, and at one point she drifted to sleep for a few minutes before jerking awake. She never pounded on the door. She simply stood and walked around the room every 15 minutes to keep her blood moving, and every time she passed beneath the camera in the corner of the ceiling, she looked directly up at it, making sure whoever was watching from the other side could see that she was still looking back. At around 7 o'clock in the morning, the ceiling lights came back on at the same moment the lock released. Sonia stood, brushed off her hands, and had taken 2 steps toward the door when it opened from the outside before she could touch it. The person standing outside the door was Marcus Vale. He was still wearing the same shirt from the night before, the creases in the collar untouched, and Sonia understood immediately that he hadn't lain down at all. Behind him, at the far end of the hallway, Arthur Kessler stood with a ring of keys in his hand and the expression of a man who had just opened every door in a very large house. Marcus didn't ask whether she was all right. He took off the coat draped over his arm and placed it around her shoulders, and when he pulled the 2 sides together at the front of her neck, Sonia saw that his hands were trembling. Not much, just enough for her to notice. Then he stepped back and gestured toward the stairs. The 3 of them went up to the study, and Arthur locked the door from the inside, then remained there, blocking it. Sonia sat down with the coat still around her shoulders and placed her phone on the table, and in 4 minutes she told them everything she had seen, the 6 vials, the temperature inside the refrigerator, the color of the rubber stoppers, the 6 delivery forms bearing the handwritten name M. Vale, in a hand that didn't belong to the man sitting in front of her. Marcus listened to all of it. Then he pulled the pad of paper toward himself and began writing, and he wrote continuously for nearly an hour, tearing off one sheet after another and pushing them across the table without once stopping to wait for anyone's reaction. 11 months ago, I called a meeting of the family council in this very room. I told them the Vale organization was going to stop. Everything that wasn't legal would be shut down within 2 years, not sold, not transferred to anyone else, but shut down. Everything that remained would become legitimate business and pay taxes. And I told them one more thing, something I thought at the time was merely procedural. I said that before anything else happened, I would hire an independent accounting firm to audit every set of books from the previous 6 years, every dollar, with no account excluded. 9 days later, I lost my voice. Sonia read the page and said nothing. He pushed the next one toward her. You'll ask why I didn't write to my lawyer. I did. 3 times. Those 3 pages disappeared from this room during the night, and I saw one of them again only once, when my wife's lawyer sent a copy downstairs for Mr. Kessler to keep on file. It bore the clinic stamp and a note saying the patient exhibited persecutory delusions. They didn't need to burn what I wrote. They only needed to submit it to the right place. The next page came across. You'll ask why I didn't call anyone outside. Vivienne is my legal healthcare representative. I signed those papers 4 years ago, when I still believed the only thing that could ever take away my ability to speak would be a bullet. From the moment that document took effect, every doctor reported to her, every appointment went through her, and anyone who wanted to hear what I had to say had to ask her first. The next page came, and his handwriting slowed. You'll ask why I didn't simply walk out the front door and go to the nearest police station. Miss Marchetti, you already know who I am. I'm not a decent man who has been wronged. I've given orders I will have to answer for until the end of my life. If I walk out of this house and speak a single sentence, the first sentence I say will incriminate me, and everyone who has stood beneath me for the past 12 years will go down with me. So for 11 months, I sat quietly in my own room and let people call me insane. He stopped writing. He straightened in his chair and looked out the window for a while, then pulled one final sheet toward himself and wrote less than he had on any of the others. The most frightening thing isn't losing your voice. The most frightening thing is that people still stand in the room with you, 3 steps away, and talk about you as though you're already dead. Sonia read the page, and she didn't read it a second time. She set it down on the table, and before she could do anything, tears were already running down her face. She wiped them away with her hand, but they didn't stop. She sat quietly for a while until her voice steadied. Then she said, Sir, my mother's name was Teresa. For the last 3 years of her life, she couldn't speak anymore. She understood everything. She saw everything. She knew who had just walked into the room and who had just lied to her, but she couldn't produce a single word. And I stood there, right beside her bed, and listened while people discussed in front of her what should be done with her, whether she should be moved somewhere else, how much time she had left, who was going to pay. They weren't cruel. That's what made it terrible. They had simply forgotten that she was still in the room. She looked up at him. Then one day I held her hand and asked her a question. I asked, Mom, do you want me to do this? And she squeezed my hand. That was all. But she cried. Sonia was silent for a long time. So when I walked into this room on the first day and heard people talking about you in the third person, I knew what I had to do. Not because I'm better than the 14 people before me, only because I've stood on the other side of that, and I promised myself I would never do that to anyone. Marcus Vale didn't write anything else. He sat very still, and for a long stretch of time no one in the room said a word. Then he extended one hand, and he didn't take hers. He simply placed his palm flat on the table, facing upward, close to where she was sitting. Sonia understood. She placed the final sheet of paper into his hand. He folded it and slipped it into his own breast pocket. Then he picked up the pen, wrote one more line, and handed it to Arthur Kessler, who was still standing by the door. From today on, everything that enters my body is to be checked by Miss Marchetti first. And Arthur, open the old document safe in my room. It's time we counted our own money again. The first thing Arthur Kessler did wasn't open the safe. He called someone he knew at the Queens County Property Records Office, and it took him exactly 2 days to learn what Danny Vale had been hiding. In 4 weeks, Danny was scheduled to close on a 3-story warehouse building in Long Island City, purchased in his own name, paid for with money he had saved from his legitimate share of the family business, along with a properly documented bank loan. Arthur laid copies of the paperwork on the table in front of Marcus and said that he had confronted Danny directly the previous afternoon. Danny admitted it immediately, and he had been furious, not because he'd been caught, but because he'd been suspected. He said he'd kept it secret, because if his brother found out he was buying a building of his own with his own money, Marcus would think he was setting up a separate operation to break away. And in this family, that suspicion alone was enough to bury a man. Sonia asked what he had meant by "everything comes to me." Arthur said Danny had been speaking to the broker, and the full sentence had been, "4 weeks from now, everything comes to me. Just keep it exactly as it is. Don't touch anything." He tapped one finger against the file. "Miss Marchetti, I've believed for 2 weeks that he was behind all of this. The problem is that I believed it too easily." Then he opened the safe. The old document safe was in the bedroom that had belonged to Marcus's father, and no one had opened it in 12 years. Inside were paper backup copies of the family's entire financial operation. Records no one had ever bothered to digitize, because no one wanted them existing on a computer. Arthur and Sonia cross-checked them for 2 straight days. He read the figures aloud, she wrote them down, and together they divided 6 years into quarters. By the end of the 2nd day, the shape of it emerged. The money hadn't disappeared all at once. It had flowed out steadily, each transfer just small enough that no one would ask questions, through a chain of companies registered in Delaware, then onward into 2 entities in Malta, with names that sounded like investment consulting firms. Altogether, over 6 years, more than $40 million had been moved. On every authorization document, every transfer instruction, every account opening form, there was only one signature, Vivienne Vale. Marcus Vale stared at that name for a very long time, then wrote one line. "She has kept the books for this family since the 2nd year of our marriage. I handed them over because I was busy, and because I trusted her." Arthur continued. There was something else. During those 6 years, 3 of the transfers had passed through an intermediary account in the name of Daniel Vale, an account Danny had opened when he was 24 and had never used. Arthur placed copies of the 3 transfer orders on the table. All 3 had been signed under delegated authority, and all 3 had been placed neatly together in a file someone had separated from the others, set right on top, clean, organized, easy to find. Sonia said aloud what all 3 of them were thinking. These 3 transfers weren't hidden. They were left where someone was most likely to see them. If anyone ever started digging, this would be the first thing they stumbled over. The following afternoon, Arthur brought up the final file, and this one had come from the family's attorney rather than the safe. It was a petition for the appointment of a guardian under Article 81 of the New York Mental Hygiene Law, filed in the New York State Supreme Court in Nassau County. The petitioner was Vivienne Vale. Attached were 3 medical certifications, one of them signed by Dr. Emmett Roth. The judge had appointed an independent court evaluator, and the law required a hearing to take place within 28 days of the issuance of the order to show cause. Arthur looked up at the calendar on the wall. 21 days remained. Marcus wrote, "If the court grants the petition, what does she get?" Arthur answered without looking at the papers. "Everything. A guardian appointed under that law can make decisions for you about your property, where you live, who is allowed to visit you, and which doctors treat you. Legally, with a court seal on it, and no one can question it." He sat down. "Mr. Marcus, all week I've been asking myself why they didn't simply kill you and be done with it. Now I understand. If you die, the entire estate gets frozen for probate. Federal agencies move in the next morning, and everything stays locked down for years. But if you stay alive and a court declares that you no longer have the capacity to make your own decisions, nothing freezes. No investigation, no funeral, just one piece of paper. And from that day forward, every signature in this house becomes hers." Sonia placed one finger on the calendar and counted. 21 days from now fell in the final week of the 12th month, since Marcus had lost his voice. She said it aloud, and Arthur was silent for a moment before nodding. "Under the rules of this family," he said, "if the head of the family can't speak his own orders before the council for 12 consecutive months, the council has the right to vote in a replacement. Writing doesn't count, because writing can be coerced. 21 days from now, in the same week, he'll lose both the court and the council." You think the filing date was a coincidence? That night, before Sonia went to bed, Arthur handed her a page printed from the house security system, the electronic lock log for the basement clinic. 3:17 in the morning on the 15th day. Remote lock command activated. Beside the entry was the device identification number that had sent the command. Arthur said he had checked it. It belonged to Mrs. Vale's phone. Arthur Kessler took 4 days to find Emmett Roth's weak point. He didn't threaten him. He simply went to the doctor's clinic one afternoon, placed copies of the 6 delivery receipts with the forged signatures on the desk, and said that the family's attorney had already contacted the Nassau County District Attorney's Office, that whoever agreed to sit down and talk first still had a way out, and whoever let the other person speak first had none. Roth sat in silence for a long time, then said he needed one night. Arthur gave him one night. The meeting was set for 9 o'clock the next morning at the attorney's office in Mineola. At 9:15, no one had arrived. At 9:40, Arthur received a phone call, and he stood listening without saying a word for 2 full minutes, then set the phone down, walked into the study, and told Marcus and Sonia that Dr. Roth had been found inside his car in a parking lot in Queens that morning. The police's preliminary conclusion was suicide. No one in the room said anything. Sonia remembered the hand that had stopped on the lid of the medical case, and she sat down because her legs were no longer steady. The next morning, she opened her mailbox in the foyer and found an envelope inside, with no stamp and no sender's name. Inside was a printed photograph, taken on a phone and slightly crooked. It showed a gravestone in a cemetery in Queens, the name Teresa Marchetti clearly carved into the stone, and the grass around the base had been freshly cut. Sonia carried the photograph into the study and placed it on the table, and she didn't say anything, because she didn't need to. Arthur Kessler looked at the picture, then stood. By that afternoon, 4 members of the family council were seated in the large dining room, and they spoke to one another in a language Sonia understood perfectly, even though no one said a single thing directly. They said there were matters that couldn't be taken into court. They said the Vale family had survived for generations by handling things like this internally. They said Marcus only had to nod once, and within 48 hours everything would be over, cleanly, with nothing that could be traced back to anyone. Arthur Kessler spoke last, and he spoke to Marcus, not to anyone else. "Mr. Marcus, I stood beside your father, and I've stood beside you for 12 years. That woman took your voice, locked Miss Marchetti in a cold room for 4 hours, and now there's a photograph of a grave sitting on that table. I'm asking you to let me do my job." Marcus Vale sat straight in his chair and listened to all of it. Then he pulled a sheet of paper toward himself, wrote exactly 1 word, and turned the page toward the center of the table so everyone could read it. No one spoke. He continued writing, and this time he wrote slowly, the letters larger than usual. "If I kill her, then I become exactly the man she described to the court. Every word in her petition becomes true, and I'll prove it for her with my own hands." Then he tore off another page. 11 months ago, I stood in this room and promised all of you that the Vale organization would stop. 9 days later, I lost my voice, and from that moment until now, not one of you has heard me repeat that promise even once, but I made it, and I keep my promises even when no one can hear me making them anymore. Sonia read that line, and something in her mind settled into place. For the past 2 weeks she had believed this man was changing, because someone had finally been willing to listen to him. Now she understood that he wasn't. He had decided to stop before she ever knew his name, before he lost his voice, and that decision was exactly why someone had taken his voice from him. Nothing inside him had changed at all. He was simply continuing the thing he had begun 11 months earlier, in silence and alone. 2 days later, Marcus Vale summoned his personal attorney and instructed him to contact the Federal Bureau of Investigation office on Long Island. Special Agent Calm Ryder arrived Friday afternoon, 45 years old, accompanied by a federal prosecutor and Marcus's own attorney, and he sat down across from the man he had spent 7 years investigating without ever managing to bring him to trial. No one shook hands. Marcus signed a proffer agreement, the kind of document that allowed him to tell them everything without that statement being used directly against him in a later prosecution, and his attorney explained every line before he put pen to paper. Then Marcus pushed a leather briefcase across the table. Inside were ledgers, names, dates, and the path the money had taken over 12 years. Column Ryder opened it, turned through about 20 pages, then stopped and looked up. He said there was one thing he needed to make absolutely clear, so no one misunderstood. What's inside this case is enough to prosecute you under federal organized crime laws, and you will go to prison whether you cooperate or not." Marcus wrote one word. "Yes." Ryder closed the briefcase and continued. "As for Dr. Roth's death, right now we have nothing. No evidence, no witnesses, and I'll tell you plainly that we may never have anything. As for the $40 million, those signatures can be challenged as forgeries, and a good lawyer can make that argument work." He looked at Sonia. "So the only thing that directly connects her to this man's loss of voice is those medication vials in the basement. We need them physically in our possession. Without them, 21 days from now, the court will hand him over to her." Ryder obtained a search warrant on Tuesday morning, and they went down to the basement at 9 o'clock, 4 people in all, including a technician carrying a refrigerated evidence container. Sonia entered the code and stepped back. The door opened. The technician opened the medical refrigerator and stared inside for several seconds before turning around. The plastic tray on the middle shelf was still there. There was nothing in it. The entire room had been wiped down as well, so thoroughly that the smell of alcohol still lingered in the air, and the drawer beneath the table was completely empty. Not a single delivery receipt left behind. Colm Ryder didn't seem surprised. He only said that the photographs on Sonia's phone were evidence that the vials had once been there, but photographs couldn't tell him what had been inside them. And without physical samples, there could be no testing. And without testing, the other side's attorneys would say they were 6 ordinary vials of steroids, mistakenly photographed by a nurse who didn't understand what she was looking at. He told Sonia to send him every photograph that morning, and to keep the originals on her phone exactly as they were. Don't delete anything. Don't alter anything. Then he left. That afternoon, Sonia performed her routine examination and wrote 3 lines in her nursing record. Patient coughed twice during lunch without choking, swallowed solid food successfully, no need to change to a soft diet. And the 3rd line, the one that made her look again a second time, to make sure she hadn't imagined it, soft palate elevated almost evenly on both sides. Asymmetry markedly reduced, compared with observation on the 5th day. She remained seated for a long time, with the flashlight in her hand. It had been 3 weeks since the injection had been stopped, and more than 10 weeks since the last injection had actually entered his body. She told no one except Arthur, and she instructed him not to tell anyone else in the house, including the staff. In the early morning of the 33rd day, shortly before 6 o'clock, Sonia heard a vehicle on the gravel. She went down to the foyer and found an ambulance parked directly in front of the steps. 2 uniformed emergency medical workers coming through the door, and Vivienne Vale standing at the foot of the staircase, fully dressed and composed as though she had been awake for a long time. One of the 2 men held out a document and said they had come to transport Marcus Vale for an emergency psychiatric evaluation under Article 9.27, and that they had certifications from 2 physicians. Sonia climbed 3 steps and positioned herself in the middle of the staircase. She didn't shout. She didn't touch anyone. She only said that she was the nurse responsible for this patient and needed to see the document first. The man handed it to her. Sonia read slowly, all the way through both pages, then looked up. She said, "Gentlemen, this statute requires the certification to be based on an in-person examination conducted within 10 days before the document is issued." She turned to the 2nd page and pointed to the date. "The examination listed here took place 64 days ago." Then she pointed to the first signature. "And the physician who signed here is Emmett Roth. He died 8 days ago." The 2 emergency workers looked at each other. Sonia took her own nursing file from her bag, opened it to the page where Dr. Helena Braun's handwritten opinion was clipped, with the clinic seal in the corner, and placed both documents into the older man's hands. These are daily care records covering 33 consecutive days, accompanied by an independent professional opinion, stating clearly that the cause of this patient's loss of voice isn't psychiatric. If you take him away this morning on the basis of that document, then within a week, you'll be sitting in front of a disciplinary board explaining why you transported a man into psychiatric care using a certification signed by a dead physician and an examination that is more than 5 times beyond the permitted time limit. She paused for 1 beat. "I'm a nurse. My name is signed in this record, and my license number is on the final page. As for you, are you willing to sign your names to that document?" The older emergency worker looked back down and reread the line with the date. Then he glanced at his partner and said they wouldn't be transporting the patient that day. Vivienne stepped forward and said in the same warm, clear voice she always used that this was a physician's order and they had no authority to refuse. The man replied that she was free to file a complaint with their office, but he wasn't putting anyone into the ambulance on the basis of that paperwork. The two men turned and left. The front door closed. The sound of the ambulance backing over the gravel faded into the distance, and only two women remained in the foyer, standing 4 steps apart on the staircase. Vivian Vale didn't become angry. She looked at Sonia for a very long time, and for the first time in more than a month, the warm cadence disappeared completely from her voice, leaving behind something flat and tired. She spoke very softly, almost quietly enough that Sonia alone could hear it. "You could have just been a poor little nurse." Then she walked up the stairs, passed Sonia without touching her, and disappeared into the hallway above. Sonia remained alone in the foyer with the file in her hands, thinking about the 7 days left on the calendar, about the 6 missing vials, and about the 3 lines she had written in the record the previous afternoon that no one except Arthur knew about yet. The night before the hearing, Sonia entered the study at nearly 11 o'clock, with the small flashlight in her pocket. Marcus Vale was sitting at the writing desk, and he looked up when she walked in. She said, "Sir, I'd like to check one more time. Do I have your permission?" He nodded. She pulled the chair closer, switched on the light, asked him to open his mouth, and shone the beam at the exact place she had examined every day for the past 39 days. The soft palette lifted, the right side rose, and the left rose with it, at the same time, to the same height, and the midline no longer pulled to one side. Sonia kept the light steady for several more seconds, then switched it off and set it on the table. She spoke very softly. "It's been almost 3 months since the last injection actually went into your body. Dr. Braun said 10 to 14 weeks. You're going to speak again, sir. It may be a few days. It may be tomorrow morning. I can't promise you a date, but it's coming back." Marcus Vale didn't move for a long time. Then he pulled a sheet of paper toward himself, wrote more slowly than usual, and pushed it across to her. "If I can speak, there is only one sentence I want to say first, and I want to say it to you." Sonia read it. She didn't ask what the sentence was. She folded the paper, slipped it into her pocket beside the others, then reached across the table and took the hand he had resting there, and the two of them sat in silence like that until the clock downstairs struck 12. At 9 o'clock the next morning, exactly 12 months to the day since Marcus Vale had lost his voice, the hearing was held inside the estate at the request of the court-appointed independent evaluator, a middle-aged woman named Margaret Doyle, who sat at the head of the table with 2 case files and a recorder. Present were 4 members of the family council: Vivian's attorney, Marcus's attorney, Arthur Kessler, Colm Ryder seated in the corner of the room, and Sonia. Marcus Vale remained in his usual seat, poised with unwavering composure. Vivian presented first, and she was flawless. She didn't shed a single tear. She said she had spent 12 months beside a husband she loved and had been unable to help. She produced 3 medical certifications, read the names of 3 doctors, read the dates, and reminded everyone that throughout those 12 months, her husband hadn't produced a single sound in front of any witness. She said she wasn't asking for power. She was asking for the right to care for him. Margaret Doyle took notes and asked nothing. Then Arthur Kessler stood and placed 6 years of records on the table, and he laid out the path of more than $40 million through Delaware and Malta, quarter by quarter, and pointed to the single signature appearing on every authorization document. Vivian's attorney waited until he had finished before speaking, and he needed only 3 questions. He asked Arthur whether he was the person responsible for maintaining the document safe. Arthur said yes. He asked whether, during those 6 years, any agency, bank, or auditor had ever independently verified those signatures. Arthur said no. The attorney said that in that case, all they had was a stack of papers sitting in a household safe, removed by the very man who held the key to that safe, at a time when that man had an obvious personal interest, without a single independent confirmation from any third party. Anyone could forge a signature. Then he sat down. Margaret Doyle wrote one more line. Then it was Sonia's turn. She stood and presented the facts exactly as she had presented them to Arthur nearly a month earlier, in the small room beside the foyer, without adding a single word of emotion, only measurements and observations. 5 injections separated by 70 days. The same sequence of symptoms recurring between the 3rd and 5th day. 6 medication vials inside the refrigerator, with photographs showing the displayed temperature. 6 delivery receipts bearing a recipient signature that didn't match the patient's handwriting. Dr. Helena Braun's professional opinion, and 39 consecutive days of signed nursing notes bearing Sonia's license number. Vivian's attorney stood, and he didn't ask her a single question about any of those things. He opened the second file and began somewhere else. Miss Marchetti, there is a complaint in your professional record with the New York State Education Department, correct? Sonia said yes, and that the complaint had been dismissed. He said he wasn't asking whether it had been true or false. He was only asking whether it was there. Then he continued, since that complaint, has any major hospital in New York hired you? Sonia said no. He asked how much debt she owed. Marcus's attorney objected, and Margaret Doyle allowed the question. Sonia gave the amount. He nodded, then turned toward the court evaluator and spoke in a very calm voice. Mrs. Doyle, this is the entirety of what we have here. A nurse who can't get hired anywhere, carrying a debt she will never be able to repay, is taken into the home of an extremely wealthy family, and within 5 days of arriving, she discovers a poisoning conspiracy that 4 hospitals and 7 doctors in 3 countries somehow failed to see. He closed the file. There are no vials. There are no test results. There are only photographs, and the story of one woman who has every reason in the world to want this story to continue for as long as possible. Sonia stood there and felt the entire room seem to recede away from her. She looked toward Vivian Vale, and Vivian Vale didn't look back, and in that exact moment, Sonia understood why. Out of the 3 files placed in front of her that day, someone had circled Sonia's name. Sonia didn't sit down. She suddenly remembered what Marcus had once written, that his 3 pages hadn't been burned. They had simply been submitted to the right place. She asked to see the file the other side had submitted to the court, and Margaret Doyle allowed it. Sonia turned to the appendix, the section marked as evidence of delusional behavior. Inside were the original 3 handwritten pages, in the same handwriting she had read every day for the past 40 days. She picked up the 3rd page. Beneath the written lines was a hurried string of characters, letters and numbers mixed together. Sonia read the sequence aloud, slowly, 1 character at a time. Then she said, Mrs. Doyle, this is the manufacturing lot number printed on the medication label. This man read it while lying in his chair and wrote it down on the very page he knew would be taken from him. Colm Ryder stood, placed the trace results sent out 8 days earlier on the table, and read the lot number printed there. Every character matched. Then he read the name of the entity that had purchased the batch, a company registered in Malta, and placed beside it the account opening records for that entity. On the line identifying its sole representative was the name everyone in that room had already seen many times that morning. Vivian Vale stared at the sequence, and everyone could see that she was looking at it for the first time. To her, that meaningless string of letters and numbers buried among the accusations had been nothing more than something written by a madman. She had never thought to compare it with her own purchasing records. Then she looked up, still calm, and turned toward the 4 members of the family council. Are you going to believe a nurse drowning in debt? Or are you going to believe the 12 months of silence that every one of you witnessed with your own eyes? At that exact moment, from the other end of the table, Marcus Vale opened his mouth. The first sound wasn't quite human speech. It came out hoarse and broken, then died after half a second. Everyone in the room turned toward him. He inhaled again, more slowly this time, and the sound took shape. Sonia. Just 1 word, fractured and rough, but everyone heard it clearly. Marcus turned toward his wife and looked at her for a long time. Then he spoke his second sentence, his voice still torn and raw, but every word distinct. I'm sane. I've always been sane. You only needed me silent. Margaret Doyle switched off the recorder and said she would recommend that the court dismiss the guardianship petition in its entirety. 15 minutes later, 2 federal agents entered the main foyer, where Gloria Pace and the household staff were crowded near the kitchen doorway. Vivian was read her rights in the middle of the foyer, in front of everyone. She didn't beg. Marcus didn't say another word to her. He rose on his own, walked through the foyer on his own 2 feet, and never looked back. 18 months later, he walked out of federal court in Brooklyn, after fulfilling the agreement he had signed with his own hand. Vivian received a separate sentence. Danny was cleared. Arthur Kessler remained to oversee the stone house in Oyster Bay. The legitimate assets that remained were placed into a foundation named for Teresa Marchetti, dedicated to training nurses who cared for patients who had lost the ability to communicate, and the foundation's director was Sonia Marchetti. At the first training session in Queens, she didn't teach a technique. She taught only one thing. When you walk into a patient's room, don't ask the family first. Ask the patient. even if they can't answer you. Even if you're absolutely certain they no longer understand anything. Because the last thing a person loses isn't their voice. It's having someone who still sees them as a human being. At the back of the room, leaning against the wall, Marcus stood listening without saying a word. His voice had been normal again for a long time, but he had kept the old habit. Listen first, speak afterward. That evening, sitting outside on the porch, Sonia asked whether he ever regretted any of it. Marcus answered in his own voice, "I once had everything, and no one listened when I spoke. Now I have almost nothing, and you're still sitting here." This story leaves behind a few simple truths people often forget. Respect begins by asking another person's permission before doing something to them, even when we're certain they can't answer. A person who can't speak isn't a person with nothing to say. They may simply be waiting for someone patient enough to wait with them. Poverty never means a person is cheap, and the most valuable thing anyone owns is the ground they choose to stand on when someone tries to buy them. Real power has never been about being able to give orders. It lies in having someone who genuinely listens. Around us are still elderly people who can no longer express what they mean. People dismissed as confused simply because they're one beat slower than we are. Sometimes all we have to do is stop, look into their eyes, and ask one question, and we may return to them the most precious thing they thought they had lost. If today's story touched you, please subscribe to our channel, leave a like, and share this video so we can keep listening together to more compelling stories every day. How did this story make you feel? And in your own life, have you ever known someone who was treated as though they were no longer in the room? Please leave a comment below. We truly hope to hear what comes from deep within your heart. We wish every one of you watching this video good health, a joyful life, and peace in every day ahead. Goodbye for now, and we look forward to seeing you again in the next video.